Well, I think, as most cities at that time, it was probably a divided population. Um, it was the very rich and the workers who were not, maybe not totally poor, but certainly didn't have any disposable income at all. If you look at the photograph of Market Square on Confederation Day, with the proclamation being read, you see there the King Street group, if we could call them that, well dressed. It's a hot summer's day, but the men are wearing their suits, the women are in those full-length dresses, hats, parasols, etc. And they would have come from the large houses which we still see on King Street, 3 or 4 floors, several generations of families living in them, stables and carriage place at the back, which you can access through the archway, and servants down in the basement who would be responsible for the food and for keeping everything clean. The next street over, and this always fascinates me about Kingston, was Ontario Street, and Ontario Street was the exact opposite. It was the manufacturing street, it had the locomotive works, it had the shipbuilding yards. It was, somebody once said, it was bars and brothels and boarding houses of the lowest kind. And those people are not evident in that picture in Market Square, probably because the entertainment that day had been a mock battle in Berryfield and a regatta and then races down in City Park. And I think that's where those people were, far away from the formality that was happening in Market Square. It's also, of course, a military town. The British Army has been here over 50 years and will stay just for a few more years, another 5 years. But there was a lot of military involved, and there had been a lot of naval, though this was rapidly fading out. So Kingston had its specialities in ships and in the military, but otherwise it was that incredible split between the rich and those who worked for the rich. Well, it had been very, very good. As I say, there had been locomotive works, engineering works. There had been a lot of shipbuilding and ship repair. It was the transshipment centre for many years. As goods were brought from the west, from both the United States and from Western Canada, through Lake Ontario, those boats could not go up the St. Lawrence, which was rocky. And so the goods would have to be transferred, so they'd come into Kingston, be put on smaller boats that could run in the river. And so there was quite a business of transshipment here. Now, 1867 is a time when the St. Lawrence's canals are being added, it's being deepened, and very slowly that transshipment business disappears, and boats now may stop at Kingston, but certainly the trade isn't needed here. But there were a lot of other things going on. Remember, it's the central town for quite a large area. It's the only large town between Toronto and Montreal. Ottawa has not yet really developed, and so it's the place where there are tanneries, a lot of printing houses for publications, woodworkers, and places for there were breweries as well. An enormous number of breweries came here over the years. So that was a sort of economy, but it was just slowly starting to deteriorate. As I say, the shipping was stopping, and it just didn't keep up with other places in Ontario and in Quebec. The newspapers are not written for that lower class of people. They're written for the highly educated people. A newspaper at the time was solid reading. You didn't have pictures, you didn't have photographs, and so there's an awful lot of, I think probably quite detailed description of what is happening, but it doesn't tell you what the people are enjoying, really. Confederation came almost as a shock. It wasn't approved by Queen Victoria until the end of March, so it's only 3 months before the day. And the newspaper reports that in the week before, 1st of July was a Monday, and as late as the Wednesday, Kingston had a celebration committee run by the mayor And it was still deciding what it would do on the 1st of July. And there's a great discussion. They knew they wanted fireworks, but they didn't know who was going to provide the fireworks, whether they should buy them locally, whether they would get them from New York City. So I get the feeling it was quite a late put together event. The program does not appear until that morning for the 1st of July. At the same time, I'm sure that people must have been excited that suddenly we're our own country. They'd seen or they had heard of this happening in the United States and how it took a revolution there for it to become its own country. They must have been pleased that Canada became a country without any of that going on. And yet I wonder if they realized how reliant they would be on Westminster for another 50, 60 years. But I think they were the general. There were certainly celebrations on Confederation Day, but I wonder how much of that was because they wanted to celebrate and have fun at the races and the regatta and watch the fireworks. Yeah. Well, there were two hospitals. Basically, KGH had been built in the 1830s. It didn't open until 1845, and the Religious Hospitals of St. Joseph had also started a hospital at the request of the Catholic bishop up on Brock Street in a building that still exists there. However, in general, people would stay at home if they were ill. They would be looked after in their own homes by their own family. It was only when the illness was, I think, probably contagious, that was when they would be moved out into a hospital. And probably with the expectation that they would not return home. There were also a number of benevolent societies, which I think was set up as much as anything because of the two difficult times with typhus and with cholera, when the city was simply overwhelmed, and the reaction to those was simply to build sheds, and I'm not sure what shed means, but it certainly doesn't suggest a particularly hospitable place. Sheds on the waterfront where those people who were suffering from an infectious disease would be put to keep them away from the rest of the population. In 1862, the Watkins Wing, the first new wing, is built on the hospital, and it's specifically for those with contagious diseases. It'll be one big ward, so you're not in individual rooms, and of course you had to pay. So that immediately cut out an awful lot of people who possibly needed hospital care. So the hospitals were starting, but they hadn't really got very far. The Board of Health was established as early as 1832, but I suspect that it was more administrative as to what to do with the immigrants who were coming in already sick. It doesn't seem to have done too much good, except to have keep people alert that things did need to be done, and to rely on people's charitable outlooks to give money to the various groups that were trying to help.